Hello, I'm Dr. Tess Mauricio. We should all be beautiful inside and out.
The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. When it comes to beauty, they say she's the best. But who is this woman they call Dr. Tess in your world? The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show.
This is the Dr. Tess Show.
Hi, my name is Philip Anthony. I'm the producer of the Dr. Tess Show.
Our producer, Phil, he travels a lot for filming for the Dr. Tess Show.
I live in West Hollywood, California with my partner, Artie Alba, who is also the director of the Dr. Tess Show. I've been working with Dr. Tess since 2011. Started working with her on RSVP with Dr. Tess, and now the Dr. Tess Show.
One day we were filming in our San Diego office, and he said, Dr. Tess, can you take a look at this? It just appeared out of nowhere.
Working with Dr. Tess now for over 3 years on her shows, I've got to see a lot of celebrities being treated. I've had time machine done on myself, Botox and things like that. But one day I noticed this mark on the side of my eye, and I asked her about it after I'd seen it for a couple of weeks. And she said, well, let's keep an eye on that. And she gave me some antibiotic ointments put on there.
And we weren't sure whether it was a scratch or, a bug bite or something, but he said, swear to God, it just appeared out of nowhere. And I said, oh, maybe it's just a scratch or something that just got irritated, so why don't you just put some antibiotic ointment?
She said, if it's not better in a few weeks, we'll take a closer look at it. So I treated it for a few weeks, and then we happened to be shooting again, so I saw her and she saw my eye.
Phil said, yeah, it's a little better, but it's still there. And I said, okay, Phil, because you are very fair, you have blue eyes, we have to make sure and we have to rule out the possibility that this could be a very early skin cancer or a pre-skin cancer.
She's like, I think we need to do a biopsy of that.
And it was totally painless because we put the numbing cream first, and it's a very quick shot, and he didn't even feel the procedure, and it was finished in like 5 to 10 minutes.
Phil is our producer, and today he is our patient. And Phil is British, and you can tell he's not Filipino. Blue eyes, blonde, and he's been all over the world, spent a lot of times in the Philippines too. And probably, Phil, you've had some sunburns?
Oh yeah, I had some really bad ones as a kid.
Yeah, and about 80% of our sun damage actually happens before the age of 18 because, when you're kids, and in the past we weren't even really aware how bad, sun exposure and sunburns are. But, once you've had a sunburn, your risk for getting skin cancer is much higher, especially if you have fair skin. Although I have diagnosed skin cancer on Filipino patients. So just because we have darker skin and we get more protection than Phil does, skin cancer can still happen. So if you have new growth, new areas, lesions on the skin that's not healing, not going away after a few weeks, you should consult your dermatologist so that we can do either a biopsy or figure out if it's a benign spot or if it's something that has to be biopsied.
Working with Dr. Tess all these years, of course, I got to see her work on a lot of people, so I was very comfortable with her actually, performing the biopsy on me. We talked about it, she talked me through it, had a little bit of numbing, so I actually didn't feel anything at all. I was actually really surprised at how painless it was.
This area here that has some redness and maybe a little bit of, pigmentation, but mostly redness. So sort of this whole area here. And, I talked to Phil, what are the options, and I think the biopsy is the most conservative, safest option, because if we just burnt it and it looked like it went away, but if it grows back, we'll have to biopsy it anyway. And sometimes if this is a very early skin cancer, it can travel and spread under the skin fairly rapidly, and it's very close to a very important cosmetic unit, which is his eye. And so I told him, if this is going to be a skin cancer, let's catch it, let's diagnose it early, so that it's very, very easily treated, and the scar will be minimal, it will be small, and it won't affect the shape of his eyes, because he has beautiful eyes. Okay?
Thank you.
And I'm sure he'll appreciate saving his skin there, right? Do you feel anything?
As in?
As in, do you feel anything sharp?
No.
You feel that?
No.
Good. All right. So Phil's numb. Okay. So, I want you to just hold this for me. Go over here, Christine. Then I go to.
We got a little bit of a specimen of the skin, and we sent that out to the pathologist.
It's weird that you can tell I'm working on you,
Right, but you
but
can't
there's
feel it.
nothing. Yeah. So you can see I only took little tiny pieces. So these are really small pieces, as small as possible, but enough to give the pathologist, something to look at under the microscope, and to give us
And then how long does that take?
takes about a week.
Okay.
Okay?
So the biopsy is going to be sent out to the lab, and we should find out within a week what they have to say, and here's hoping to good results. The Dr. Tess Show is brought to you by Lifeline Stem Cell Skincare.
We all have issues with our face and skin at any age. Now stem cell technology can help. Introducing Lifeline, stem cell in a bottle.
I found the most amazing technology. This is human stem cell technology, but these stem cells are not embryonic.
Sabi nila bumata daw ako. Saka nawala yung mga wrinkles, tapos nag-glow yung face ko.
Skin becomes brighter and clearer just after a few days.
Buy one, get one free at mbeautyclinic.com. Hurry while supplies last.
You know what I don't understand? Women take care of their husbands, their kids, their jobs. Pero pagdating sa sarili nila, bakit wala? Bakit kaya? Showbiz is a lot like real life. If you take care of yourself, people will respect you. And you know what? If you're happier, mas masarap kang kasama.
You can look and feel beautiful at any age when you take care of your face and body. We use the latest technology to make you look 10 to 20 years younger without surgery, without the fake look.
So ladies, kahit na gaano kayo kabisi sa ginagawa ninyo, huwag niyong kakalimutan ang sarili ninyo. Take care of yourselves because, trust me, you're worth it and you deserve it. So go to the best, Dr. Tess, America's favorite dermatologist. I did, and I'm happy. Mukha ba?
So ladies, when you're ready to take care of yourself, we're here for you. Tama ba, Gabby?
Sure, Dr. Tess.
With M Beauty by Dr. Tess.
I am extremely excited to announce that after 2 years of development and clinical testing, I am premiering my own skincare line, Timeless MD by Dr. Tess. The #1 skin concern I see in my clinics is skin discoloration, and I have had tremendous demand from my patients worldwide for a home care solution that can visibly reduce discoloration for a brighter, more even-toned, younger-looking skin. My Timeless MD products were created specifically for these concerns. Our clinical results on real subjects in my practice surpassed my expectations, and our users were thrilled with the results that they received. Now, all of my patients and viewers worldwide can experience medically validated products that deliver real proven results at home with my easy-to-use Timeless MD by Dr. Tess illuminating system. Be one of the first in the world to experience Timeless MD by Dr. Tess and receive over 20% off the regular price. Plus, receive a copy of my book, California Total Beauty. So go to drtesstimelessmd.com and pre-order now.
Timeless MD. It's like a time machine in a bottle.
Dr. Tess Show.
So after waiting for about a week, the results came in.
I'm really happy that Phil agreed to do that because when the pathology report came back, it was a pre-skin cancer.
Finding out that it was precancerous was actually a good thing, of course, because we caught it early. If it had been left and if I hadn't been working with Dr. Tess, I probably wouldn't have done anything about it, and it could have actually turned into cancer.
And so this is what we call actinic keratosis, and it's a really good thing that he works with a dermatologist because he may have just ignored it. A lot of people would have just ignored a little area like that that's kind of not healing. You would just think, eventually it'll heal, you just ignore it. And pre-skin cancers like the one that Phil has can turn into skin cancer that will require major surgery, and you can imagine it's near his eye.
Skin cancer actually runs in my family. My dad has actually had a couple of pieces of skin removed because they were cancerous also. So, of course, to be able to catch it early was a blessing. So after we got the results, we scheduled to go down there to M Beauty with Dr. Tess to have her actually remove the other part of the mark that was still on my skin. We actually froze it off with liquid nitrogen.
So we're here today with Phil. Phil, as you all know, is producer for the Dr. Tess Show, but today he's the patient. Again, about 2 weeks ago, we did a biopsy on a spot here. It's still a little red from the biopsy. And this is a spot that Phil said just appeared out of nowhere. And he thought that he scratched it, but it just wasn't healing. Pathologists looked at it under the microscope and they found that the cells of the skin that we biopsied are no longer normal, they're abnormal, and they are on their way to becoming a skin cancer. So it's good that we caught it early.
Yes.
It's good that we're friends and he has access to just do a biopsy, because technically those pre-skin cancers, if you leave them and do not treat them, they have a very high potential of turning into true skin cancer. So that is the reason why if you have a new spot or just new growth, it's really important to go to an expert, go to a dermatologist. Do not take chances, because the one thing that the pathologist also looked at is to make sure that this was not a melanoma. Melanoma is the skin cancer that actually kills people, especially young people, because you just ignore it, you think it's a freckle or a sunspot, and then it ends up being a killer skin cancer. But because now that we know it's a pre-skin cancer, then there's a little area there that I'm going to treat using liquid nitrogen, okay?
She told me she was going to freeze off the part that was left with liquid nitrogen, and that should destroy any of the precancerous cells that were left on the skin.
So here it is. Okay, close your eyes. So I'm going to treat that one little area there that still has pigment. Just get a little bit more. Close your eyes. So this is very cold that it actually burns the skin. And this is going to give you a scab. And when the scab peels off, you should not have that spot anymore.
She explained to me it was a simple process, pretty pain-free. So we did a little bit of numbing. I like to get numbed, of course. And so I laid down, and then she treated the area with a large Q-tip, which she was dipping into the liquid nitrogen. And as she placed it on my skin, it would actually freeze and destroy the cells.
Do you have to treat the biopsy site?
No, that one's already.
That took care of it.
One more round, and then we're finished.
What's weird is I can feel the cold going down the side of my face, the cheek.
But this part
The
is
air.
numb.
Yeah.
All right. That's it. That's it, and we'll just watch that area very carefully. If there's any new growths after this peels off, then obviously come back, and then we'll evaluate it again.
We'll monitor that area very closely and just make sure that it doesn't come back and that it doesn't, turn out to be a skin cancer.
But again, this is very important because although we talk a lot about cosmetics and how to look younger, how to look better, this is really a true, medical dermatology case where we actually found a pre-skin cancer on film. It's kind of crazy.
Yeah, it can happen to anybody.
It can happen to anybody. You're right. When you have fair skin like Phil and blue eyes, definitely higher chance, but I definitely have diagnosed skin cancer on Filipinos, and melanoma can happen on Filipinos as well. So don't take your chances. If you have any new growths, any new spots, consult your dermatologist.
So it's been about 3 weeks now, and as you can see, there's just a little bit of a red mark here on near my eye.
The take-home message is, one, find a friend who's a dermatologist. Two, if you don't have a friend who's a dermatologist, then, find a good dermatologist, because don't ignore any of spots or new growths or new pigmentation on your skin. Make sure you go to the expert because it could be a skin cancer.
I'm really happy with the results. Dr. Tess has told me, don't worry about the mark, we'll get rid of that with some laser treatments. Had I not been working with Dr. Tess, I might have ignored it like most people would, but I would definitely recommend, if you see any new moles or marks on your skin, that you actually reach out to a dermatologist. It is very simple to treat. We caught it early, and I'm just lucky to have Dr. Tess be around to be able to actually treat me like that.
The Dr. Tess Show is brought to you by Lifeline Stem Cell Skincare.
We all have issues with our face and skin at any age. Now stem cell technology can help. Introducing Lifeline, stem cell in a bottle.
I found the most amazing technology. This is human stem cell technology, but these stem cells are not embryonic.
Sabi nila bumata daw ako. Tsaka nawala yung mga wrinkles, tapos nag-glow yung face ko.
Skin becomes brighter and clearer just after a few days.
Buy one, get one free at mbeautyclinic.com. Hurry while supplies last.
Ang sikreto ko ho, exercise, syempre. Diet, of course, importante yun. At maraming tulog. At ang pinakasikreto ko sa lahat,
Hi, Gabby!
Dr. Tess!
Sorry, late ako ah.
Okay lang, alam ko busy ka.
Okay, prepare ka na ha?
Okay. Gotta go. Dr. Tess Mauricio, America's favorite dermatologist. Yan ang sikreto.
So now, you ready for your next time machine?
Ready, Doc?
Let's start na.
Let's go!
And Beauty by Dr. Tess.
In my trade, people go to great lengths to look younger and more beautiful. I believe you can retain, enhance, and even turn back the clock without going under the knife.
There is no need for a facelift, a brow lift, or eyelid surgery. The Time Machine uses the latest technology to make you look 10 to 20 years younger without surgery, so you always look natural.
You should try Dr. Tess's Time Machine. I did, and I couldn't be happier.
So Marie Vivian is our stem cell patient. Nakita niyo na siya in our earlier episodes na, she's a marathon runner over 10 years, and she started having difficulty with pain whenever she runs. And her doctor already told her, you have to stop running, but this is her passion. She loves it. So we did the regenerative cell therapy where I extracted her fat. She loves it because now she doesn't have her hip fat. We took her fat and then we transformed and harvested the regenerative stem cells from her fat, and then we injected the stem cells in her knees. So months later, mga 4 months later, she's feeling great. She's back training again on the treadmill, doing 10 miles on the treadmill, and now she's running marathons again.
Hi, this is Marie Vivian on Facebook. I'm here to do the 10K run, and it's been 4 months since Dr. Mauricio had performed the stem cell surgery on my knees. So I'm excited to give it a try, and woohoo! I'm all set to go. Yay! Ready or not?
So Marie she's running again. She's running marathons, and the very first marathon that she did after we did her regenerative cell therapy, she won first place in her age category. So it's so amazing. She's always posting on Facebook how much better she feels when she's running. She's running faster than ever. She's running like she did when she was younger, and it's just so amazing what this stem cell therapy can do.
The Dr. Tess Show is brought to you by Lifeline Stem Cell Skincare.
Thank you very much. My favorite moisturizer.
So you have a day and a night. And this
day
is
and night. This is for Pang-Gabby, right?
Mm-hmm.
Pang-Gabby.
Yeah.
And this is for
the day.
The day, okay.
Yeah.
All right. I really like this product, so I enjoy it. If I can only drink it, I'll drink it.
We'll put it all over.
Today.
All
Yeah.
over.
The neck, hands, face, put it everywhere.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our tickle lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
I wanted to try something more natural, and when I found out about Dr. Tess, I felt immediately comfortable with her.
My husband was complimenting me and saying how young I looked, and it's nice because he's 4 years younger than I am.
The wrinkles, my skin has improved, it's tighter, it's amazing. The youthful look that I have, the freshness.
You just can't describe how it makes you feel inside. I feel good, I feel like I look good, I feel young.
The years have come off. It's a fabulous experience.
Welcome back to Gab with Dr. Tess Show. We have questions here, and this is maraming tatanong nito. Although I have a personal insight on this one. Si Cherry Fe from Tucson, Arizona. And sabi ni Cherry, I've always had a flat nose, and I want to impress this guy who I like and want a nose job. So, but I don't want the one that's too obvious, sabi niya. Most of my friends tell me that I don't need to do it. And some guys like me for who I am, and I believe that I don't want to change my looks. And to be, is that superficial of me, or do you recommend it and all that? Alam mo, some women really look good just like that, di ba? If you're gonna go to a doctor, if you really want to have your nose done, in my opinion, tinan mo muna yung mga iba-ibang klaseng na ginawa niya. Because baka mamaya it might turn south, baka hindi magandang craftsmanship. Kasi ang doktor, meron din yan eh. And ask your friends, ask talaga you have to look at yourself and see, bagay pa sa akin yung ganitong klaseng nose. Kasi minsan mukhang fake. Doc,
yes.
may mga pros and cons yan, di ba?
Absolutely. And kung gusto mo lang i-try out kind of a higher nose, usually for Filipinos, ang talagang issue is they just want a higher nose, the bridge of the nose. You can actually test drive a higher nose. We can use what we call non-surgical nose job, where I inject a filler, like Juvederm, to basically increase the height of the nose, and it happens instantly. It makes a lot of people happy, and then they can kind of decide, okay, do I like this look? The nice thing about the fillers actually is I can make it look very natural, and that's what she's looking for, because we can blend it in. It's a soft material. It's not like an implant that can look fake. So I would say, kung talagang decidido ka, you think you will look better or you'll have more confidence, you'll be happier with a higher nose, try out a non-surgical approach para hindi permanent kung magbago isip mo.
Wow! May sample ka naman, no?
Oh, yeah.
Mag-umpisa, no?
Very commonly done in my clinic.
And maybe you have a computer that will show you more or less what you're gonna look like. No?
Yeah, it depends. Kung talagang nose bridge lang, kayang-kaya yan. But the artistry of the doctor is very important when you're dealing with your nose job.
Sabi nga nila, Doc, well, thank you very much, Cherry, for that phone-in, or is that No, it was a text, not a question. Okay. I have a question here, no? From Ryan Cruz from Minnesota. And sabi niya, I get migraines after... What's this?
Often. I get migraines often. Can Botox really help?
You know what? I've never heard that
Have you
before.
had migraine before?
Well, I don't know if it's called migraine. I have a headache, but a migraine, that was really bad though. It's worse and it lasts for a long time.
I had migraines.
So I can't relate to that.
I had migraines when I was training, doing my medical training. I used to get it every time. It was painful. You almost feel nauseated. You can't deal with bright light. And this is actually the reason why I first got Botox for the first time is for my migraine.
You can actually get a Botox to remove migraine?
Yes, it's FDA approved for the treatment of migraines. How they think it works is that it addresses some of the trigger muscles. So if you can't contract certain muscles, then you can't start the pain. But it works so great for me. And then the nice bonus is that it also prevented wrinkles from happening. And apparently enough people experience this positive basically result from Botox for their migraines. It's FDA approved.
Wow.
Yeah, so if you have a migraine, it's worth a shot because I know that you are suffering.
That's pain, no? Pain up here and all that.
Dito.
Well,
Nasusuka ka.
Masakit ang puso mo, meron bang Botox para doon?
Wala ata.
Wala.
Yeah, wala.
Okay.
Not yet.
Okay.
Botox for the heart.
Thank you very much for all the questions, no? Ryan, maraming salamat.
So hopefully nakatulong yan sa inyo. This week and next week, balik na naman kami ni Gabby on Gab with Dr. Tess. Send in your questions and we might answer them live.
See you next week. Ingat po kayo.